Welcome to the Healthiest Tech Talks, where we're talking about some of the biggest challenges facing healthcare organizations today and how technology can transform the way we work so that patients receive better care. I'm your host, Natalie Tollefson, Senior Director of Customer Success at Optimum Healthcare IT. Let's dive in. Fantastic. Well, hello, everybody. Thank you so much for joining us today. We are here in our second Healthy as Tech talk, talking about how a major health system modernized HR operations in just 8 weeks. And I am so thrilled to have this conversation to really look at one of Optimum's customers and partners in the healthcare industry and look at the success that they're having with HR. So today we have the honor of being joined by Alison Hamm. Alison is the Director of People Analytics and Shared Services at Tampa General Hospital. I'm going to give a little bit of a background on Tampa General as well as Alison, and then we'll jump right in. So Tampa General Hospital, they are a 981-bed not-for-profit academic health system based in Tampa, Florida, one of the largest hospitals in America, and I believe the only level 1 trauma center in the region as well. Tampa General has achieved several accolades from industry analysts and consumer ratings. They ranked as the U.S. News and World Report's best hospitals for 2023 through 2024. They were designated as a model of excellence by the Fortune and Meredith Top 100 hospitals last year, and they were ranked in the top 100 hospitals nationally for America's best employer for women and one of the top employers, 25 employers in Florida. So, wow, that's incredible. I feel honored to have such an esteemed organization here with us today. And a little bit about Alison. So, Alison has her bachelor's in international affairs from Florida State University. She has an MBA from the University of Wisconsin. And Alison has spent the past 13 plus years at Tampa General Hospital, working within their human resources, or what they call people and talent division. And she is currently leading their HR transformation initiative with ServiceNow. So welcome, Alison. Thank you for being here.
Thank you so much for having me, Natalie. Happy to be here.
And I know that you have a really exciting milestone coming up in your personal life. Is that right?
Yes, I do. Expecting my first child next month.
Awesome. Congratulations, Allison.
Thank
That's such
you.
an amazing journey. And I'm glad we were able to get you on Healthy as Tech before you go on your leave, because we have such a great story to share with our guests. So thanks again for being here.
Of
So
course.
team, let me set the stage here. Again, we're discussing this topic of HR modernization and really diving in and taking a magnifying glass to this use case at Tampa General Hospital. Tampa General was facing some challenges that I think a lot of healthcare organizations face today and are wrestling with. And it's really about how to modernize HR service delivery, right? The way that HR delivers service and provides support to their employees, how to do that quickly and effectively. And this can look different depending on the organization, depending on the different complexities that each one is facing. Those nuances must be taken into consideration. For Tampa General specifically, there's several layers to this scenario. Some are all, which will likely resonate with many of you that are listening. We are dealing with mergers and acquisitions. We have, HR really moving away from email-based processes to more of a digital platform self-service approach. Building and executing an enterprise employee experience strategy. And then also the scenario we have here where Tampa General is implementing the ServiceNow platform across their enterprise, but starting with HR, which is pretty cool. So Optimum has the privilege to be Tampa General's implementation partner for their ServiceNow journey. We are walking this road as we speak. It's been really exciting, and we have Alison here to share more about the success that they've seen so far and also what's next on the roadmap. So, Allison, we met last fall, and Tampa General had a pretty specific imperative at the time that was time sensitive. Can you paint us a picture of what that challenge was, and what were you personally tasked with?
Yes. So last fall, TGH began the process of acquiring three community hospitals that was going to transition under our health system umbrella as of December 1st, 2023. Um, the specific task that me and my team were tasked with is standing up a HR service delivery model for these hospitals to align with their acquisition date. So these hospitals, that were being acquired, they're going to lose all of their legacy HR support from their prior corporate system. So it was really imperative that we were able to stand up, you know, basic HR service delivery for these hospitals immediately upon their transition. So I believe, I think Natalie, when we first engaged with you guys, we were about 8 weeks from the acquisition date. And I think, as we all know in healthcare, sometimes we can't pick our go live dates, our acquisition dates, and so we had to run towards this December 1st date and make sure we hit our targets.
Yeah, and I remember the pressure in the room, just realizing that this go live date is not something we can move. We've got to be successful here. And not only that, Allison, obviously acquisitions, those happen all the time in healthcare, and I'm sure many that are listening have been through that or know that there needs to be operationally a way to support those new employees as they join. But what was your existing Tampa General employee population experiencing, and what were some of the challenges that that you were going to be addressing anyways for the enterprise in terms of your HR roadmap?
Yeah, so we had actually kind of been on a journey to transform our HR service delivery from primarily face-to-face interaction, email interaction, that was really focused on our academic medical center where we had, a majority of our employees and our local ambulatory clinics that were in the local metro area and really scaling our delivery model to support the wider health system. I think, as of this month, we have over 90 ambulatory locations, the academic medical center, as well as, the three acquired hospitals. So we were already starting the journey to through automation and efficiency to optimize our service delivery. But the acquisition of these hospitals that were just outside of the Tampa Bay metro area really presented another layer of complexity um, into that plan.
Yeah, and I think, so how many employees, just to kind of ground our audience here, how many employees does Tampa General have? And then how many employees was the acquisition hospitals introducing to the mix?
So we had just over 11,000 employees back in November when we did the acquisition under the Tampa General Hospital system umbrella, and then with the acquired hospitals, we added 1,600 more.
Okay. Wow. So yeah, there's a lot going on there, right? And not only that, but we also know that your IT department is also looking at implementing ServiceNow in particular to really reach that next level of digital transformation with IT. So for those that are listening, I think this is such a great example because we're really hitting several different items that I think are pretty relatable to other health systems out there. So And that's a lot of pressure to, have to deliver something, just within a couple months, but, the great news is that we were able to do it. So we'll talk more about that, but, Allison, I mean, what was at stake if we weren't able to get HR Service Delivery up and running for this acquisition by December 1st?
Well, I think it was exactly that, that there wouldn't be an HR service delivery model available to
Yeah,
these new hospitals, to the 1,600 team members. When you acquire a hospital or when you acquire multiple hospitals, there's not really a break
mhm,
between when the acquisition happens. Care continues to be provided, payroll has to happen, hires are made, and so the goal of any acquisition is to make sure all of that is seamless as possible. So, if we weren't able to get this stood up, this was going to be a real barrier in the way of making sure those day to day operational activities that are, critically important to providing patient care
sure.
were happening.
And it sounds like the existing processes that were in place for your existing employees wasn't necessarily going to meet the mark as you introduce a whole new entity and a whole new, set of employees into the fold. S Mhm.
Right. Yeah. The options and the processes we had in place at the time were just, not something that we could scale to add to these new entities.
Yeah, great point. So, let's talk about how we actually pulled it off. And it was such a great experience. I need to let our audience know working with Allison and her team. I'm gonna share my screen here. So, everyone, this was a great example of one of Optimum's, accelerated offerings, which is called HR Vitals. And what I have here on the screen is just an overview of that approach. And this is essentially how we were able to be successful with Tampa General's, impending deadline to go live with HR Service Delivery, which, as you probably know, is one of the core products on the ServiceNow platform, for employee experience, for HR productivity. And essentially, what this included was, one, we were starting with HR. So, the team set up the core platform in terms of users and groups and locations, things like that. It also included HR case management and knowledge management so that employees had self service capabilities and resources at their fingertips, as well as the ability to submit requests. We also set up the Employee Center portal, which started as an HR-centric portal for self-service, but then will transition into more of an enterprise portal for Tampa General. And kind of on the back end of that portal was an agent workspace for those HR agents, those members of Allison's team, who would be managing cases that come in from employees. We also did an data integration with Tampa General's core HR system of record, UKG, for the acquisition, that is. And following go live, we are continuing to provide extended post go live support and continuing to make enhancements on the module. And so really, Allison, I think the way that we ended up implementing this was centralized on having, prescriptive approach, right? Optimum providing, here's what the best practice is, here is how we deliver to our customers, and giving you some more straightforward decision points to make. And that helped us move along faster, would you say?
Yeah, I would agree. Having that, really kind of prescriptive design approach really was able to solidify our scope early on.
Mhm.
And from there, having um, those real defined decisions made it much easier to get decisions made in a timely fashion. So we were able to stay on time and, work decisions through the appropriate acquisition decision process.
Yeah, and it was just really helpful to, also have the support of you and your team with, staying focused, making those decisions quickly, having some governance in place to, to keep moving things forward. Optimum also provided enhanced testing and training support, because we know that not everybody is, equipped or maybe even experienced with doing things like user acceptance testing, writing those test scripts. So that's another way that we were able to partner. Allison, what was that experience like for your team?
I think having Optimum support, particularly for the testing, was really critical. We were, doing the testing prior to the divestiture from the prior health system.
Mhm.
So the local HR staff that normally we'd involved in user acceptance testing, they weren't available to us. So having Optimum be able to step in, write test scripts, and work through test cases and partnership with us was, really valuable for getting through that phase of the project.
And we had a great time doing it too. Our teams have become
Mhm.
quite close. So, and then lastly, having those pre-built accelerators, right? This was just a way that internally Optimum was able to expedite our development effort, by having, some of these HR services, for example, these catalog items pre-built, and we were able to move faster because of that. Allison, we went live with just around 10 different catalog services. You want to tell us a little bit about some examples of what those were?
Yeah, so we went live with a case management system, the knowledge bank. We put together a custom position request process
Mhm.
for the acquired hospitals, as well as a custom tuition and skill reimbursement process. Um,
I think we had some general inquiries for benefits.
yes,
We
yes,
had
yes.
general inquiries for HR. I know I'm putting on the spot a little bit. And I think we had badge requests as well.
Yes,
Yeah.
yes, yeah. So the general inquiry, not only for benefits, but for HR, and even really flowing into some of those payroll functions. The benefit content
Mhm.
was super valuable to have as well. Um, and then the badge request process was really critical for us being able to go live, particularly since badges, printing badges, delivering badges is definitely a local function, and having that integrated though to the wider health system, we really needed a workflow to set that up.
Yeah. So, and I just remember walking through each of these, workshops and designing those use cases. And one of the things that we had to make sure we kept in mind is that, we're building this initial pilot, if you will, for the hospitals that are being acquired. But we needed to create that foundation from a place that could easily be extensible to the broader TGH enterprise, right? And so that was another factor that, those in our audience might want to consider as you're looking at doing a phased approach for HR service delivery. And you want to get quick value, but then you also know that you want to be able to expand and enhance those services across your enterprise. There's definitely ways that we can do that, just like we did with Tampa General. So Allison, for others that may be listening, other HR leaders in healthcare who maybe they're considering what their roadmap looks like for HR technology, or they're really looking to address some of the problems, some of the challenges that you shared earlier, what would be the main piece of advice that you would give them?
I would say my main piece of advice is to make sure that the scope of what you are implementing, you've really done the due diligence on the front end to align it with your strategic plan, either for, people and talent, or for your wider organization. And, really making sure that the things that you are implementing are the most important things, and, you're kind of able to prioritize and work through your work list in a logical, structured, intentional fashion.
That's great advice. I think that'll definitely help someone out there. So Allison, let's talk a little bit about what you guys are focusing on right now. I know that our teams are, as we speak, working on the roadmap and delivering the next phase. I have on the screen here a high-level overview of Tampa General Hospital's HR roadmap. Allison, walk us through what's the next priority on deck for you guys?
Yeah, so our main priority for the current quarter is implementing new hire onboarding. I think this is a pain point for many organizations, and so we are really setting out to drive and create a holistic onboarding experience for new hires that not only takes account the HR onboarding task, but also includes education, training, IT access management systems, getting hardware, and is really a end-to-end process for our new hires, and as well as giving hiring managers visibility into that process.
Mm.
Our goal really is to create kind of a streamlined experience for our new hires. First impressions, of course, matter, and making sure that we're able to hit all of these targets within the HR onboarding workflow, is really what we are endeavoring to build out currently.
Wow. I mean, onboarding is such a hot topic. I hear about it all the time. I mean, what do you think it was, with you and perhaps your leadership that really expedited the need for this to be the very next thing that gets implemented? Why was it so important to you guys?
Yeah, I think with the current labor market conditions, um, TGH has been very successful in expediting our hires. We have a really strong internal talent acquisition team, and we have been able to hit our hire targets, month after month, quarter after quarter, which I think is really, really impressive, particularly in the current conditions, and speaks really well to our talent acquisition team. But if we're able to hire at that kind of rapid clip, we need to be able to onboard at that same rate and
Mm.
be providing these new hires, a really high quality experience as they're welcome to the organization. Because if we're hiring them that fast, it doesn't matter unless we're able to get them up and working and productive, on the patient care unit. So, for us, having a streamlined onboarding process is really key to being able to do that.
Mm. Yeah, I mean, I was just reading the other day some stats. I think one of them was the cost of nurse turnover alone. It ended up coming out to $52,000 per nurse that turns over, and physician turnover even more, right? Because you have potentially a more difficult time recruiting and placing those. You have extended onboarding periods that could add up to potentially $1 million per physician because of the lost revenue from treating patients on the floor faster. And so I mean, Allison, do you feel like the being in the healthcare industry and network with your peers, do you feel like the costs of onboarding or I guess the cost of an inefficient onboarding process that health systems really understand, what that actually is costing them today?
I, I think there's some understanding across the board that, inefficient onboarding, there are costs attached to it.
Hmm.
It can be hard to quantify concrete costs for it, but, I think everybody is aware that inefficient onboarding means slower to be out on the unit, slower to
Hmm.
be seeing patients. So, just being able to have that rapid onboarding it's critical to being able to maintain adequate staffing levels.
Yeah, for sure. And the retention value as well, right? Having
Oh
um
yeah.
like you said earlier, that first impression really
Hmm.
matters. And that I think contributes heavily to retention. So, well, kudos to you and the team for tackling such a complex process. I am so excited for when we go live with it. I think it's going to be awesome, and I can't wait to share that success with everyone. Tell us a little bit more about what else is on your roadmap in the next quarter.
Yeah, so we are working on setting up a streamlined offboarding process, as well as optimizing our job and status change process. Currently we have a very manual paper process. So we are looking to replace that with a more streamlined approach through ServiceNow. We're also looking at options and ways to enhance our leave of absence process in the coming quarters and year, um, to be more friendly to and user friendly, have more information at the fingertips of employees. Um, and then, of course, we're always optimizing and adding to our HR content and knowledge bank, to really support those HR inquiries that come in.
Fantastic. I think it's going to be such an incredible journey for you all, and the level of transformation that your employees will experience in terms of having more access at their fingertips, 24/7, the ability to get their issues resolved or to find the information they need. I'm just really excited for the Tampa General organization, especially as you're growing rapidly and achieving such great success out there. So congratulations. So, Alison, thank you for walking through your roadmap. Um, I'm so curious what others might think about some of these items as well, because I think, a lot of our customers are really interested in going with this direction. But, for other health system HR leaders, what's a piece of advice that you would give them as they consider their overall strategy for HR tech and for employee experience?
I think it's important that we look at this from the perspective of the team member, and make sure that what we are implementing and the way that we organize the information we are providing to the team members is designed to enhance that user experience, and we're offering information in a way that's usable and understandable to the team member, because ultimately that is our customer.
Mm.
Um, so I think that is, really important when you're thinking about the overall design of how we lay out these kind of service delivery processes and systems.
Yeah, and by team member, you really mean that end user, that employee who's walking through that
Mhm.
journey, whether it be a clinical provider or, another type of employee, right?
Exactly. Yeah.
Yeah. I think that's great advice. And thank you for sharing that. I hope that those listening really find it helpful as well. So, for everyone, if you are experiencing similar challenges to Tampa General, where you're dealing with manual processes, maybe a lot of workaround steps, legacy tools, and really just facing the complexity that comes with, um, really complex processes like onboarding, which span many different functions across an enterprise, or complexities that come with hospital acquisitions, like what Alison has shared with us today. Know that you're not alone. There are strategies and solutions to help you overcome these challenges and to really bring that vision that you have for your employee experience to reality, bring that to life. So, Scott, I'll transition it to you to see if we have any questions.
Oh, we have a lot of questions. This is great. Sounds like you all did quite the work. And, I'm just curious, Allison, when you started, you have such an ambitious timeline, you have such an ambitious plan, you bring Optimum in, you know, eh, how did it feel as you began the process? For me, it was overwhelming thinking about it. Did that lift with time, and how are stakeholders and how is everybody feeling today?
So we are, let's see, 4 months post live now.
Mhm.
Um, and I feel like we are in a really good place. We're stable on the application. we've been able to optimize some of the workflows. I think, we all know what you think you need for go live and what you might actually need post live sometimes can be a little bit different. So we've been able to optimize some of these workflows with ServiceNow once the local hospitals came online, and we were able to gain their feedback and better understand their current business processes and structure and organizational culture. So I think that has been hugely important to making the ServiceNow implementation at TGH North a success.
That's great. Yeah, and you spoke about towards the end there the importance of getting employee buy-in. So in terms of the 3 hospitals that were using different systems, did you have any kind of employee adoption challenges?
I think, there's always adoption challenges that come along with system implementations. It's something definitely that should be focused on, and the implementers really have to pay attention to. We really went out of our way to offer training, education, and really leverage the local HR teams to help transition the local staff members to using ServiceNow, familiarizing themselves with it.
That's great. Now, ServiceNow is traditionally, known as an IT platform, and I'm just wondering, did you need ITSM set up on ServiceNow before you could roll out HRSD? And if not, are there any risks in rolling out HRSD first?
So we did not have ITSM set up first. We were able to roll out the workflow we needed. I think, there could be some risks inherent if you don't have your service model stood up through that platform, kind of the robustness of the ticket intake process. And for us, we have a very close working relationship with our IT department. We pass tickets and cases between the teams all the time. And so there was a little bit of a challenge of not having them stood up on the platform yet. When we went live at first, they were still on their legacy platform, but I'm happy to report that ITSM is going live in April. So we'll be excited to all be back on the same platform again together.
That's great.
And
So
it's one step closer to that enterprise vision, right? Of really having
Exactly.
that one-stop shop where employees can just go straight to one place, whether it's HR, IT, or another function, they can get what they need without really having to think too much about it.
Yeah, and I think that is exactly what we're looking to have is the one-stop shop for all information, whether you have, you need a piece of IT hardware or you need information about a benefit offering. Um, you know, it's almost like the Amazon of service delivery for
Right.
employees.
that's great. Great. And HR led the way, huh?
We did. We were first out of the gate.
That's amazing. Okay, Natalie, this may be a question for you, but when it comes to building an HRSD roadmap, what advice do you have for identifying top priorities to be included in that plan?
Yeah, that's a great question. And Allison even mentioned it earlier. It really comes down to understanding, what are your priorities, right? Like, what are those key problems that you're looking to solve? In the same way that Tampa General knew that they needed to get HR support up for this acquisition quickly, but then priority number 2 was really about new hire onboarding. I think it's important for HR leaders out there to really become in tune with what the challenges are on the ground. What are the experience gaps that their employees are facing? What are the productivity gaps that their team members are facing internally, and build your roadmap that way. The other thing too, Scott, that I'll say is by working with an implementation partner, specifically one that has healthcare experience and HR domain expertise, then you're able to really collaboratively strategize on, like, technically which pieces need to go first, so that you can build from that, right? Because there is a way to implement ServiceNow. It is not just a pick and choose your features. There is a best practice approach to implementing certain things in the right order. and a lot of considerations with that. So yeah, I would say it's, knowing your priorities, knowing what challenges you're really trying to solve, and then working with that partner to really be strategic about technically how you need to phase the implementation to achieve your overall goals.
That's great. Thank you. Okay, I think we have time for one last question. And for everyone that has joined us, please check the chat. We do have links to both Natalie and Allison's LinkedIn so that you can stay in touch with them. And if you have any follow-up questions. And we also have a link to our main ServiceNow webpage for you to learn more on Optimum's website about the offering. Alison, what would you say are the greatest, most notable outcomes that you're seeing across the organization after this initial implementation?
I think for us, one of the most valuable outcomes is the ability to really quantify the types of requests we're seeing, understand our customer population better. What are they coming to ServiceNow looking for? What are they trying to do? Are they having success through the workflows, and being able to take action on that data? I think that has been just super powerful for our team, and will be a great asset as we look to continue to optimize our offerings through ServiceNow.
That's excellent. Congratulations on the implementation and on the continued success. And congratulations again, Alison, on your first child. And
Thank you.
Very much looking forward to hearing about that as well. And thank you for everyone who joined us. And you can find us on Spotify and across your favorite podcast platforms. You can listen to us anywhere you go here for Healthiest Tech. Natalie, Alison, everyone who joined us, thank you so very much today.
Of course. Thanks for having me.
Thanks, everyone.
See you now.